Welcome to the deep dive. Today, we're tackling something, well, really fundamental. How to proactively safeguard our health.
Hmm.
Especially now, with chronic diseases becoming so much more common.
Yeah, it's a major concern.
We're not just talking about treating illness after it hits, but really getting into how to build sort of resilience through disease prevention.
Exactly. Being proactive.
Think of it like being your own health advocate, yeah.
Hmm.
Armed with the right info to stay well.
That's a really crucial shift in how we think about health.
Mm.
And what's so powerful about prevention is its ripple effect.
Right.
It's not just individuals who benefit. A focus on prevention really can lead to healthier communities overall. We're going to explore some concrete, evidence-based actions you can actually take, drawing from some really rigorous expert analysis.
Exactly. And central to our discussion today is the United States Preventive Services Task Force, the USPSTF. Now, this isn't just, another health group. It's an independent panel of experts. They meticulously go through all the available science to figure out which preventative measures genuinely work.
Their mission is pretty straightforward, but profound. Improve the health of all Americans.
Yeah. And what's interesting, I think, is their focus.
Right. Their recommendations are specifically for people who are currently healthy, people without any signs or symptoms of the disease they're looking at.
It's all about getting ahead of potential problems, isn't it?
Precisely.
And their recommendations, they carry real weight. It's not guesswork. The USPSTF has this really intense process.
Oh, absolutely.
They dig deep into the research, carefully weighing the benefits of a service against any potential harms or downsides.
And that leads to their letter grades, A, B, C, D, or I for insufficient evidence.
Right. And those grades, they have a real impact, don't they? They influence what doctors recommend, often what insurance covers, thanks partly to the Affordable Care Act.
Definitely. An A or B grade is a strong signal. It means the evidence shows a clear net benefit for that preventive service.
So our mission in this deep dive is to basically pull out the most vital, evidence-backed recommendations from all this info.
Yeah, and translate them into practical steps, things that you, the listener, can hopefully integrate into your life to protect your health, to stop disease before it even starts or catch it early.
Okay, so let's start by maybe getting a handle on the idea that prevention isn't just one thing. It's like a spectrum of strategies, different levels.
Exactly. How we try to prevent disease depends on where someone is, sort of on that health continuum. We often talk about 5 distinct levels.
It's 5 levels. Okay.
The first is primordial prevention. This is about stopping the risk factors themselves from emerging in the first place, across a whole population. It's broad, societal.
Okay, primordial. Can you paint a picture? Like, what does that actually look like?
Sure. Think about increasing taxes on tobacco. The main goal isn't just getting current smokers to quit, though that's great too, but preventing young people from ever starting.
Ah, I see. Stopping the risk factor smoking from developing widely.
Exactly. Or, another example,
Hmm.
urban planning.
Hmm.
Creating safe sidewalks, bike paths. That encourages physical activity just as a normal part of life.
Right. Preventing sedentary lifestyles across the board.
Yeah, shaping the environment for health.
Okay, that
Yeah.
makes sense. So that's primordial. What's level 2?
That's primary prevention. This is probably what most people picture when they hear disease prevention.
Okay.
It's about preventing a specific disease from starting in people who are healthy but might be susceptible, reducing exposure to risks or boosting resistance.
So like getting a flu shot, that's primary.
Perfect example. Vaccination is classic primary prevention. You're protecting yourself before exposure. Or offering stop smoking programs to people who already smoke. That's primary too, because you're trying to prevent smoking-related diseases like cancer or heart disease from developing down the line.
Got it. So stop the disease before it starts. Then we get to secondary prevention.
Correct. Secondary prevention is all about early detection, finding disease when it's still asymptomatic.
Meaning you don't feel sick yet, no symptoms.
Exactly. The idea is to catch things in the early stages when treatments are usually more effective, and you can potentially stop it from getting worse.
So this is where screenings come in, like mammograms for breast cancer.
Precisely. Mammography aims to find breast cancer early, maybe even before a lump can be felt. Or regular blood pressure checks to catch hypertension early. That's secondary prevention too.
Okay, early detection. Got it. What happens if a disease has already taken hold?
That brings us to tertiary prevention. So at this stage, the disease is established, people often have symptoms, the focus shifts. It's now about minimizing the disease's impact, managing complications, improving quality of life.
Like physical therapy after a stroke. To regain function.
Exactly. Stroke rehab helps patients get back as much function and independence as possible. Or managing type 2 diabetes with medicine and lifestyle changes to prevent complications like nerve damage or vision loss. That's tertiary.
Okay. And then there's one more, quaternary prevention. That one's a bit newer to me.
It is, yeah. Quaternary prevention is basically about protecting people from over-medicalization.
Over-medicalization.
Avoiding unnecessary tests, treatments, interventions that might actually cause more harm than good. It's about being cautious, patient-centered.
Can you give an example of that?
Sure. Think about using antibiotics carefully.
How?
Not prescribing them for viruses or that don't work and just contribute to antibiotic resistance. That's quaternary prevention, preventing potential harm from unnecessary medicine.
Okay, wow. That really clarifies the different layers. So as we dive into the specific USPSTF recommendations, it sounds like we'll be mostly in that primary and secondary zone.
That's absolutely right. The recommendations we're about to discuss are largely focused on empowering you, the listener, to make informed choices, preventing disease from starting, or catching it early when it's most treatable.
All right, let's get into some of those key screening recommendations then. First up, hypertension. High blood pressure. What does the task force say?
So they strongly recommend universal screening for hypertension. That's for all adults 18 and older.
Universal, okay.
Their initial recommendation is an in-office blood pressure check. But what's really interesting is they emphasize confirming high readings with measurements taken outside the clinic.
Oh, right, to avoid that white coat hypertension thing, where it's high just because you're at the doctor's.
Exactly. So it's not just about one high reading during your checkup. And the frequency might vary based on age and risk factors.
Makes sense.
But the key thing is regular screening, because hypertension is a huge risk factor for cardiovascular disease, heart attacks, strokes, and it often has no symptoms.
The silent killer, yeah. Definitely need to screen for it. Okay, what about prediabetes and type 2 diabetes? Seems like we hear about those constantly.
We do. The USPSTF recommends screening for prediabetes and type 2 diabetes in asymptomatic adults, aged 35 to 70, who are overweight or obese.
35 to 70, overweight or obese.
Right. But they also note, kind of concerningly, that it's rising in younger people. So they suggest screening might be appropriate earlier for folks with other high-risk factors.
That's important.
And early detection here is just critical.
Yeah.
Because interventions like lifestyle changes, diet, exercise can be really effective in preventing or at least delaying progression to full type 2 diabetes.
Yeah, good to know. Okay, shifting gears a bit to mental health. What about screening for anxiety disorders?
So the USPSTF recommends screening for anxiety disorders in adults up to age 64.
Up to 64.
Yeah, and that includes pregnant, postpartum individuals. That's a really significant point given the unique stresses of that time.
Absolutely.
Interestingly, they found there wasn't enough evidence to recommend for or against routine anxiety screening in older adults 65 plus. But it really highlights the big impact anxiety can have on overall well-being, especially in younger and middle-aged adults.
Totally. Mental health is health. Okay, let's talk cancer screenings. Colorectal cancer is a big one. What's the guidance there?
The USPSTF recommends screening for colorectal cancer in all adults aged 45 to 75.
45 now, right. That changed recently.
It did. It used to be 50. So grade A recommendation, their highest level for ages 50 to 75, and grade B for 45 to 49, still a moderate net benefit.
Okay.
And then for adults 76 to 85, they say the decision should be more selective based on individual health, past screenings, life expectancy.
And there are different ways to screen for it, aren't there?
Exactly. Colonoscopies, very stool-based tests. It allows for a more personalized approach, which is good, based on preferences and risk.
Okay. How about breast cancer screening, mammograms? There's been discussion around the starting age for that, too.
Yes. The latest USPSTF recommendation is for biennial screening. So every other year with mammography for all women aged 40 to 74.
40 to 74 every other year.
Okay. They found insufficient evidence regarding screening for women 75 and older. So this update, lowering the start age from 50 down to 40, is pretty significant.
Yeah, that is a big change.
It reflects evidence suggesting that earlier detection in that 40-49 group can lead to better outcomes and, importantly, help address some disparities we see in breast cancer diagnosis and mortality.
That's really important work. Okay, moving on. Depression screening.
Here, the USPSTF recommends screening for depression in all adults. That includes pregnant and postpartum individuals and older adults 65 and up.
All adults. Wow.
Yeah, depression can affect anyone across the adult lifespan. They did note, though, insufficient evidence for routine screening for suicide risk specifically. in the general adult population.
Okay.
But the main takeaway is depression is common, and proactive screening is important for identifying and addressing it.
Got it. And just quickly, any other key screenings people should know about?
Yes, a few more worth mentioning briefly. Screening for hepatitis C virus, or HCV, in adults 18 to 79. Screening for HIV. That's recommended for adolescents and adults 15 to 65, anyone at increased risk, and all pregnant individuals.
Right.
For people with a significant smoking history, there's annual lung cancer screening with low-dose CT scans for adults 50 to 80 who meet certain criteria.
Okay, specific group there.
Yes. And finally, osteoporosis screening, assessing bone density, recommended for women 65 and older, and also for younger postmenopausal women who have specific risk factors.
Wow. Okay. That's a really helpful rundown of the major screening recommendations. Now, screenings are obviously critical, but our daily habits, our behaviors, they play a huge role too,
Oh,
right?
absolutely. Equally vital.
So what does the USPSTF recommend around behavioral counseling?
Yeah, they have several key recommendations there. Top of the list, maybe unsurprisingly, is tobacco use.
Makes sense.
They strongly recommend clinicians ask all adults about tobacco use, advise them to quit, and then offer help. Behavioral interventions, FDA-approved medications for non-pregnant adults who use tobacco.
So ask, advise, and assist.
Pretty much. It just underscores the massive harm from tobacco and the need for real support to quit.
Definitely. What about alcohol?
They recommend screening for unhealthy alcohol use in all adults 18 and older, including pregnant women.
Screening for everyone there too.
Yes. And for those found to be drinking at risky or hazardous levels, they recommend brief behavioral counseling interventions to help them get back.
Okay. And STIs, sexually transmitted infections, any counseling recommendations?
Yep. Behavioral counseling is recommended for all sexually active adolescents and also for adults who are at increased risk for STIs.
Gotcha. Obesity is another major issue. What's the advice there?
For adults with a BMI of 30 or higher, that's the clinical definition of obesity, the USPSTF recommends offering or referring them to intensive multi-component behavioral intervention.
Intensive multi-component, so not just eat less, move more.
Right, more structured support for weight loss.
And lastly, just general healthy eating and physical activity guidance.
So for adults who already have risk factors for cardiovascular disease like high blood pressure, high cholesterol, they recommend behavioral counseling on healthy diet and physical activity.
Okay, if you have risk factors.
Yes. For adults without known CVD risk factors, they say clinicians should sort of individualize that decision based on their judgment, the patient's preferences, their situation.
Interesting. So it sounds like the USPSTF really sees healthcare providers playing a key role in starting these conversations, offering support for healthy behaviors.
Definitely. Now, moving beyond screening and counseling, are there any specific preventive medications the USPSTF highlights?
Good question.
Yes. One really key recommendation involves statin use for primary prevention of cardiovascular disease.
Statins. For cholesterol, right? But for prevention.
Exactly. Specifically for adults aged 40 to 75 who have at least one CVD risk factor, could be dyslipidemia, which is abnormal cholesterol, diabetes, hypertension, or smoking history.
Okay, one risk factor.
And whose estimated 10-year risk of having a cardiovascular event like a heart attack or a stroke is 10% or higher.
Ah, so it's a combination. Risk factors plus calculated risk level.
Precisely. For that group, the USPSTF recommends clinicians prescribe a statin medication. It's not a blanket thing for everyone 40 plus. It's targeted primary prevention for those identified as being at elevated risk.
Got it. That's really clear. This has all been incredibly insightful. Now, if we were to try and boil all this down, synthesize these recommendations into maybe a top 10 list of actionable steps someone listening can take, what would make that list?
Okay, yeah, let's try to pull it together. Drawing from the USPSTF and, broader health consensus, here are maybe 10 key steps you can focus on. 1, eat a healthy diet. Focus on fruits, vegetables, whole grains, lean protein, low-fat dairy. Try to limit added sugars, saturated and trans fats, sodium. The dietary guidelines for Americans are a great resource for details.
Okay, diet first. Makes sense.
2, get regular physical activity. Aim for that 150 minutes of moderate aerobic activity or 75 minutes of vigorous each week, plus muscle strengthening twice a week. The benefits are huge: weight, heart, mood, blood sugar, blood pressure control, reduced risk of CVD, type 2 diabetes, some cancers.
Activity, crucial. What's 3?
3, get enough sleep. Aim for 7+ hours of quality sleep nightly. It's vital for metabolism, immune function, thinking clearly. Lack of sleep is linked to higher risks of obesity, diabetes, heart disease, depression.
Sleep. Often overlooked, but so important. Okay, 4.
4, quit smoking or never start.
Yeah.
Still the biggest preventable cause of so many serious diseases. If you smoke, get help quitting. Resources are out there.
Absolutely key. Number 5.
5, limit alcohol intake. Moderation is key. Typically no more than 1 drink a day for women, 2 for men. Though some, like the WHO, suggest avoiding it altogether might be best for health. Excessive drinking raises risks for liver disease, cancers, heart disease, stroke.
Moderation or avoidance. Got it. 6.
6, get recommended vaccinations. Keep up with the CDC schedule for your age. Annual flu shots, tetanus boosters, shingles, pneumococcal for older adults, COVID-19. Vaccinations are core primary prevention, protects you and the community.
Vaccinations. Yes. 7.
7, get regular health screenings. Follow those USPSTF recommendations based on your age, sex, risk factors, early detection for hypertension, diabetes, cancers, mental health issues. It just leads to better outcomes.
Screenings. We covered a lot there. Okay, 8.
8, manage stress. Find healthy ways to cope. Exercise helps. Mindfulness, nature, hobbies, connecting with people. Chronic stress really takes a toll physically and mentally.
Stress management. Big one. 9.
9, know your family history. Understanding your family's health gives clues about your own potential genetic risks. Share this with your doctor. It can help personalize your prevention plan, maybe earlier screenings, different lifestyle advice.
Family history. Good point. And number 10.
10, practice good oral hygiene. Brush twice daily with fluoride toothpaste. Floss daily. It prevents cavities, gum disease, and there's growing evidence linking oral health to overall systemic health, too.
Oral hygiene, right. That's a fantastic list. Really actionable, brings everything together.
Yeah, hopefully practical.
So as we start to wrap up, it feels like this deep dive has really provided a ton of evidence-based info, hopefully empowering everyone listening to take a more proactive stance on their health.
Absolutely. The USPSTF recommendations, those 10 steps, they offer a really solid science-backed framework for preventing disease, promoting long-term health.
And it's good to circle back, remember those different levels of prevention we talked about at the start.
Mm-hmm.
While a lot of what we discuss falls under primary and secondary things we can do as individuals, it all contributes to that bigger picture of a healthier life, a healthier society.
That's exactly right. And, maybe the most crucial step you can take after listening to this is to talk to your own healthcare provider. Yeah. Have that open conversation. They can help assess your specific risks, figure out which screenings and preventative steps make the most sense for you, and build that personalized plan.
Definitely. So here's maybe a final thought to leave you with. Thinking about how interconnected all these things are, diet affects sleep, exercise cuts stress, and so on.
Yeah, it's all linked.
What's maybe one small, manageable change you could realistically make, maybe even starting today, that might create a positive ripple effect for your overall well-being and your long-term health? Maybe just pick one area we talked about and explore it a bit more.
A great question to ponder.
Thanks for joining us for this deep dive.